Swadikap. Good afternoon once again, Thursday, 27th of May, 2021. Dr. Tweesin ended just now with very valuable information in that, as I've mentioned before in the various briefings prior, that the fluidity of the situation actually dictates a lot of our decisions, the flexibility and the adjustments that we have to make every single day. Now, nobody knows exactly if the set of information that we receive last night or this morning, for example, would change as the hours go by in each morning. Now, I think it's a learning process for Thailand. It's a learning process for all of us around the world as well. But nevertheless, we continue to try our best to communicate and provide you with the most updated information and communicate to you the measures that have been adjusted on a daily basis, which is necessary, as I've mentioned quite often, to be flexible and to be in tune with the fluidity of the ever-changing situation of COVID, because the situation changes every day in each location, in each the severity of the infection in each particular cluster or area. Today we have, for example, remaining 41 clusters in Bangkok, which we hope to address at the earliest opportunity. So that being said, I'll start off with the numbers recorded for today. With the new recoveries first, we have 2,063 new recoveries. 2,063 persons who are now treated and COVID-free. For confirmed case recorded today, we have 3,323. And out of that number, 2,083 are cases of local transmission, 21 are from overseas infections, and the rest are from within the prison systems or the penitentiaries. Now, I have recorded for today 47 new fatalities, making the cumulative total of fatalities to date at 920. So very sad to report this every day. The numbers of fatality are in the 40s in the past few days, hoping that won't go higher. We had in the last weeks around 20-ish each day. Just some observations from the spokesperson, Dr. Tweesin, just now, that the overall situation has actually plateaued nationwide. That is to say that the infection rate in both Bangkok and other provinces remains somewhat stable, with clusters of new infection and infection from existing clusters found sporadically. Now, construction workers' campsites, as Dr. Tweesin just now had a graphic there, and including markets, especially large wholesale markets, and informal settlements surrounding those areas continue to be places of concern. The proactive monitoring and active case finding measures are continuing to be conducted in these places, and inter-provincial travel is being closely monitored and enforced in various provinces. The border areas, border area arrivals remain active in contributing to the cumulative cases. And as I mentioned the other day, the security agencies, border police and the like are being very strict in terms of fending off illegal entry through the natural entry, the natural pathways between Thailand and the neighboring countries, where we have found a lot of illegal entry, both of foreign nationals and of Thai nationals as well, through these illegal channels. So just some information regarding Bangkok. BMA strictly controlling, with efforts in strictly controlling the COVID outbreak, because it has been found in many areas in Bangkok and it has continued to spread. As I mentioned, 41 remaining clusters in Bangkok. And ongoing reports of infections have found specific locations, as I mentioned, construction worker campsites. In light of this, the Communicable Disease Committee of BMA has approved the issuance of the announcement on the surveillance, prevention, and control measures for the spread of COVID instructing several district, local areas, including markets, campsites, to comply with public health measures and prevent the spread of COVID as prescribed by the committee, with the details of the such measures. And the BMA has also ordered all district offices where there are construction worker campsites to allow officers from the municipality to strictly inspect business operators and employers at the camps to ensure that they comply with this announcement that I mentioned, the surveillance, prevention, and control measures announcement as guidelines, as the standard. The inspection conducted thus far found that various organizations and agencies have followed the said measures in earnest so far, so that's good news for Bangkok. Meanwhile, the proactive testing mobile units, jointly with the public health centers in different areas, have also been conducting active case findings in areas of concern, markets included, and of course, with areas with the general public who come in contact with positive patients or in high-risk groups in their respective districts. Now, just a general information on when you get vaccinated in the near future. As registration in Thailand has, of course, begun in earnest, we would like to offer information on what to expect during vaccination, just to prepare yourselves. The first step is for the medical personnel to assess whether you're ready to receive the vaccine. Of course, that will be a conversation with the patient, with you. And if you're qualified for this vaccination, then the medical personnel will administer the vaccine for you through intramuscular injection. The recommended waiting time in Thailand that we have set is 30 minutes after each jab, to make sure that there are no unexpected reactions. So, of course, in other countries, you might have seen images of these drive-through inoculation sites, or people going on the streets to vaccinate people. But in Thailand, we have set this standard for 30 minutes of observation time after being injected with the vaccine. We are being very, very careful. And of course, this is according to the health standards. And we don't want, of course, anything to happen to anybody, a Thai or foreign national who received the vaccine after they receive the vaccine, unintended side effects, for example. And after 30 minutes, there will also be the follow-up on the 1st, the 7th, and the 13th day after your first dose by a competent medical professional calling you to make sure that you have no unintended side effects or complications on the first day after the jab, the 7th day, and the 13th day. And for those who already have received the jabs, you are encouraged to continue to exercise physical distancing, hand hygiene, respiratory etiquette, and other social distancing measures as recommended by the competent authority. And as mentioned, the mass inoculation nationwide would not start until the 7th of June. But of course, some specific groups, such as the elderly or those in particular risk areas, have already begun to receive the jab, so to speak, in the soft launch period before the 7th of June. Another issue I mentioned quite often is stigmatization of COVID-positive people. As more and more people have recovered from COVID in Thailand, as I mentioned, there are over 90,000 patients who have recovered already to date ever since last year. And there have been many reports of people being treated differently, even to the point of being subject to alienation for fear of spreading the disease. So we wish to reaffirm that we should all encourage those who suspect that they have fallen victim to COVID, being positive, to come forward and give as much detailed information to medical personnel as much as possible. Don't conceal the information, your timeline, and also about your symptoms, to health professionals, so that they will be able to receive to provide the proper medical care and attention to you. Equally, it is medically proven that those who have recovered from COVID can no longer spread the disease and should not be treated differently. We would like to reiterate our call for the proper treatment, fair treatment of all people, so no one falls victim to social stigmatization. And you have an infographic there. You have an infographic there for you on screen. Yes, so basically this is what I have for you for today. Please remember to strictly adhere to the measures. We talk about this every single day for you. And thank you for your cooperation and thank you for your attention today. Have a great day ahead. สวัสดีครับ